Public health nutrition is concerned with promoting and maintaining the nutritional health of the population. In recent times, the Australian public health system has steered its focus towards the overconsumption and dietary imbalances which have contributed to the epidemic of obesity and diet-related diseases such as diabetes, some cancers, and cardiovascular disease. Public health defined by the World Health Organization refers to all organised measures, whether public or private, to prevent disease, promote health, and prolong life among the population as a whole. Its activities aim to provide conditions in which people can be healthy and focus on the entire populations, not the individual or patients or diseases. Thus, public health is concerned with the total system related to health as a whole. Public health improves the overall health of the population by creating public policies, which incorporate a population-based health strategy. These strategies are implemented through health promotion, which aim for everyone in the key population to receive readily accessible and good and relevant information. Health promotion happens within homes and communities and also aim to help communities focus on healthy choice being an easier choice. Health policies are developed in a cost-effective sense and supported by community data, which is with a science base. This ensures the ability of public health to adjust their scale of resources to meet the needs of the health outcomes and ensures that disparities within the community can be catered for to improve the overall health of the population. With these health policies, it is important to ensure that promoting health isn't just for a selective group. Children, working adults, parents, seniors, professionals, and policymakers all have a role in improving the nation's collective health status. Community health is a subsection of public health. It's a discipline which concerns itself in a study and improvement of health characteristics of biological communities. In comparison to public health, community health tends to focus on geographical areas rather than people who share characteristics of the overall population. There are 4 categories and factors affecting the health of the community. Physical factors, which include geography, environment, and community size. Social and cultural factors, which include beliefs and traditions, socioeconomic status, social norms, and the local economy. Community organisation, for example, the availability of health agencies, and individual behaviours such as physical exercise and dietary habits. From these 4 factors, Community Health Service uses the tools to help implement a gold standard of community health practice. These standards are epidemiology, community organising, and community health education. Caulfield Community Health Service is located in the city of Stonington and Caulfield. Its population profile includes the local government areas of City of Stonington, the City of Glen Eira, and some parts of the City of Port Phillip. Caulfield Community Health Service is a part of the Alfred Health Framework, and as a result, Caulfield Community Health incorporates the same vision, mission, and values of Alfred Health. At Alfred Health, the organisational structure integrates a chief executive with general counsel team and also chief officers for each medical and allied health team and a chief development and educational officer. Alfred Health and Community Health Service have many interrelationships with organisations including both educational and council. Through previous health promotion strategies and opportunities, Caulfield Community Health Service have built a number of partnerships and interrelationships with community and health agencies, local government, and other stakeholders. These relationships will continue to develop and enhance to best meet the needs of the community. Community involvement and expectation of Caulfield Community Health Service include the access to completing surveys which highlight the community health service and the greater needs of its local population. Therefore, Caulfield Community Health Service have the ability to provide health promotion catering for the needs of its community. Caulfield Community Health is separated into 2 adult teams, the Healthy Aging team and the Healthy Families team, which both provide a multidisciplinary approach for adults within the Caulfield Community Health Service catchment area. These disciplines include community health nursing, occupational therapy, physical activity programs, social work, physiotherapy, podiatry, speech pathology, and of course nutrition and dietetic services. At Caulfield Community Health Service, dietitians provide community health for paediatric care adolescents, which are offered to children and adolescents aged between 0 and 18 years. Families, which incorporate the nutritional needs for family in their home environment, which can also lead to discussion and education of nutritional adequacy with modifications if need to a special diet, and also adults, where Caulfield Community Health Service dietitians offer individual consultations at the centre or if needed at the client's home. Barriers which influence healthy eating in the community include practical measures such as cost, access to the rights of education, knowledge gaps, already developed habits, access to the rights of types of food, and also efforts of governments, public health authorities, producers, and retailers put in to promote general healthy eating. On the Alfred Health Vision, Caulfield Community Health Service follows the health priorities of the Alfred Health Framework. These are overweight and obesity, nicotine dependency, and healthy aging. In contrast, Caulfield Community Health has its own strategy direction which influences an independent vision of building a healthier community. And therefore this leads to developing an independent mission of working together in partnerships with clients, carers in the community to optimise quality of life and well-being. Caulfield Community Health Service aims to optimise the quality of life and well-being of clients and carers in the community by ensuring that most in need have access to the right to service at the right time, delivering a holistic approach to services that result in excellent client and community outcomes, educating and empowering individuals and communities to manage their own health, and working in partnerships with the community and other key stakeholders to address the broad determinants of health. In addition, Caulfield Community Health Service ensures that cultural competence. They do this by social inclusion. This includes ensuring that strategies and programs are appropriate and inclusive for culturally and linguistically diverse groups, Aboriginal and Torres Strait Islanders, people living alone, and other groups at risk of socialisation and exclusion. This is important for culturally and linguistically diverse groups living within Caulfield Community Health catchment area. Thus, having this access providing each individual who live in the community improves the overall community healthcare.